A coalition known as Civil Society in Malaria Control, Immunization and Nutrition, Acomin, has stated that the battle against malaria in Nigeria is a pivotal juncture. Consequently, the organization is advocating for an immediate shift from a model reliant on external support to one that emphasizes local ownership and enduring resilience. During a media briefing, Acomin State Coordinator Oluwafunmilayo Olatunji highlighted the recent substantial decrease in donor funding coupled with the economic downturn and says it poses a significant threat to malaria interventions within the nation. Speaking through the Secretary Tayo Akinpelu, he remarked that the notable decline in malaria cases underscores the urgency of investing in malaria response framework developed by Nigerians for Nigerians. He emphasized that Nigeria must demonstrate resilience, promptness, and adaptability in its initiatives to bridge the malaria gap in the country.
The fight against malaria in Nigeria is a critical crossroad. With donor funding rapidly shrinking, we can no longer rely solely on external support to sustain the progress we have made. As such, there's an urgent need to transition from a dependency-based model to one rooted in local ownership, self-sufficiency, and long-term resilience. By harnessing and mobilizing resources from within local communities, the following can be achieved. Transparency and accountability. When community invest in and take ownership of health initiative, transparency and accountability also improve, as people are most likely to monitor the effective use of the resources and demand better service delivery. We would like to call on government, our own their government, at the federal level, at the state level, and at the local government level, should fulfill all co-financing commitments that has been made on behalf of our country, of our states, and of our communities. We also want to call on government to increase funding and releases of funds for malaria interventions and program, TB interventions and program, and HIV interventions and program.
Various speakers, while advocating for support for primary health care facilities throughout the state, asserted that communities should assume greater responsibility for their healthcare systems. They also acknowledged that the community-led monitoring initiative being executed by Acomin has produced significant outcomes.
For malaria to be eradicated in Nigeria, we all have a part to play, right from the community. I think he mentioned in the presentation that the traditional rulers, the religious people, if you educate the community and the community starts using the nets as at 20, definitely we end malaria at that level.
I know if we all play our parts, it's possible we end malaria in Nigeria. Currently, I know the federal government is thinking about rolling out, if they have not rolled out the malaria vaccine. So those are things that the country is actually doing. For donors and for partners, our goal is to ensure that we should get up, we should be in a situation whereby no one will be down again because of malaria. We don't need to lose life again, and we don't need to lose working hours just because of malaria.
Hello, hope you enjoyed the news. Please do subscribe to our YouTube channel and don't forget to hit the notification button so you get notified about fresh news updates.